Hello, this is Dr. Jeffrey Frankel, and on behalf of my co-authors, I'm pleased to present our study, Vibegron shows meaningful changes in clinical endpoints in patients with overactive bladder, analysis for EMPOWUR. This slide shows our disclosures. The study was sponsored by Urovant Sciences. Overactive bladder is characterized by frequency and the sudden urge to urinate, with or without urinary urge incontinence. OAB negatively affects patients' health-related quality of life. Such reductions in bothersome symptoms of OAB, although demonstrated in clinical trials, often do not interpret the meaningfulness in regards to patients' perception. In the 12-week phase 3 EMPOWUR trial, Vibegron significantly reduced micturitions, urgency episodes, and urinary urge incontinence episodes versus placebo. This analysis assessed the meaningfulness of reductions in clinical endpoints observed in the EMPOWUR trial using patient perception of improvement. The study design involved adult patients with both OAB wet and dry. They were randomly assigned 5, 5, and 4 to receive Vibegron 75 milligrams, placebo, or tolterodine 4 milligrams extended release respectively over 12 weeks. Patients completed the PGI-C at weeks 4, 8, and 12. We used an anchor-based approach to interpret the meaningfulness of reduction in micturations, urgency episodes, and UUI episodes based on the PGI-C from 12-week phase 3 EMPOWUR trial. The median percent change from baseline at week 12 in each outcome was generated for each PGI-C category pooled across all treatments. The following cutoffs were utilized: greater than 15% for reductions in micturations, greater than 50% for reductions in urgency, and greater than 75% and 90% for reductions in UUI episodes. This slide shows the demographics of the study trial at baseline. They were similar across all groups. The mean age was 60.2. Women comprised 85% of the trial. The percent wet was 77%. Median micturations per day at baseline was 10.9. Urgency episodes averaged 7.9, and urgency urinary episodes of incontinence averaged 2.6. Baseline clinical observations were similar between treatment groups. Across the treatment groups, patients reporting moderately better PGI-C had a median percentage reduction from baseline in micturations of 18.2%. A significantly greater percentage of patients receiving Vibegron versus placebo achieved at least a 15% reduction from baseline in micturations. Overall, in looking at the urgency episode group, patients reporting a much better PGI-C score had a median percentage reduction of 60.9%. Significantly more patients receiving Vibegron versus placebo achieved at least a 50% reduction from baseline in urgency episodes compared to placebo. Patients reporting much better PGI-C had a median percentage reduction from baseline of 93.2. A significantly greater percentage of patients receiving Vibegron versus placebo experienced at least 90% reduction from baseline in urinary urge incontinence episodes, similar to the significantly greater percentage of patients experienced at least a 75% reduction in the EMPOWUR trial. In conclusion, significantly more patients treated with Vibegron versus placebo achieved meaningful reductions from baseline to week 12 in micturations, urgency episodes, and UUI episodes that were associated with patient-perceived improvement. Results of these analyses support the meaningfulness of the reductions in clinical endpoints observed in the 12-week EMPOWUR trial. Clinically meaningful improvements in bothersome symptoms of OAB would be expected to help patients achieve treatment goals and contribute to greater patient satisfaction and treatment persistence. Therefore, Vibegron is felt to be a new treatment option for patients with overactive bladder. Thank you.